The lumbo-pelvic hip complex functions as an integrated neuromusculoskeletal system and is essential for human upright function. It is the body's balance point, the central connection between the upper body and lower extremities. It is the fulcrum for transfer of movement and force between these body segments while simultaneously providing stability within a bipedal framework. Dynamic stability of the lumbo-pelvic region is important because of the need to repetitively transfer weight, movement, and force of the upper body through this region to the legs and feet, and vice versa. The pelvic rotator cuff facilitates lumbo-pelvic hip stability through motor control of sequential, synergistic multi-plane motion and mid-range multi-plane rocking around the sacroiliac balance point. Stability arises from both passive and active components. The passive osteoarticular components include the actual shape and cartilage of the sacroiliac and symphysis pubis joints and the passive ligamentous structures supporting the SI joints bilaterally, including the sacroiliac ligaments, sacrospinous ligaments, and sacrotuberous ligaments. The ligaments supporting the symphysis pubis joint are the superior, inferior, anterior, and posterior pubic ligaments. These ligaments are non-contractile tissue that stabilize the joints through passive length tension. A dynamic component is added when muscle and associated fascia interdigitate with ligament tissue. As the muscle contracts, force transfers through the ligament, affecting the joint structures to which the ligament is attached. This can be seen in the adductor longus fascial interdigitation with the anterior pubic ligament. As the adductors contract, they exert force on the symphysis pubis, resulting in joint approximation. As the ligamentous and osteoarticular structures form the passive elements of dynamic stability, the muscles of the pelvic rotator cuff form the active elements of dynamic stability. In contrast to medium and long arc muscles, such as the gluteals and hamstrings, which move the legs through large amplitude motion, the short arc muscles of the obturator internus, superior and inferior gemelli, are characterized by being of relatively short length, running obliquely from origin to insertion, and moving the limb through small, mid-range rotation motions. For the purpose of illustration, we have exaggerated the minute motions of the symphysis pubis and sacroiliac joints which we will be examining. Pelvic rotator cuff action during the obturator contraction phase causes the hips to roll out and appears to compress the sacroiliac joints while decompressing the symphysis pubis joint. The obturator phase also appears to facilitate nutation of the sacrum. The base of the sacrum moves anteriorly in relation to the pelvis, which tilts posteriorly. In addition, the obturator's connection to the pelvic diaphragm via the arcuate tendon causes the pelvic diaphragm to lift, closing off the outlets for bladder and bowel during obturator contraction. The adductor longus and brevis have fascial connections that cross over the symphysis pubis joint and blend with the anterior ligament. Bilateral action of the adductors during the adductor contraction phase appears to compress the symphysis pubis joint and decompress the sacroiliac joints. Pelvic rotator cuff action during the adductor phase appears to facilitate counternutation of the sacrum. The base of the sacrum moves posteriorly in relation to the pelvis, which tilts anteriorly. In summary, during the obturator phase of pelvic rotator cuff action, there is outward rotation of the femur, sacroiliac joint compression, symphysis pubis decompression, sacral nutation, and posterior pelvic tilt. These motions occur simultaneously and are inseparable in function. During the adductor phase of the pelvic rotator cuff action, there is inward rotation of the femur, sacroiliac joint decompression, symphysis pubis compression, sacral counternutation, and anterior pelvic tilt. The equal but opposite balancing act of the obturator and adductor phase creates a continuous rocking motion around the neutral balance point of the sacroiliac, symphysis pubis, and lumbosacral joints, and facilitate dorsal and ventral ligamentous support of the sacroiliac joints in the neutral, stable position during upright activities.